Okay, welcome back. We'll begin our public comment session. At the onset, I'd like to welcome and thank the public commenters for addressing the committee today. All speakers today submitted a request in advance of the meeting, and the final list of public commenters was determined via lottery. For the speakers, I wish to inform you that you have limited time for comment. That's 3 minutes. In order to make it through all the list of speakers, it's extremely important that each of the speakers limit their comments and remarks to 3 minutes. We will be displaying the time on the screen so that you know how much time you have left. Public input and engagement is vital to the ACIP's work, and we appreciate your presence here and look forward to your comments. If you exceed your time or as you approach your time, I will thank you for your comment and tell you that your time is expired. If you go past that time, I will note the expiration of time. As a courtesy to other speakers, we ask that you conclude your comment. And finally, if you exceed more than a minute, your comment time will be ended, and I will end it by saying your comment time is ended. Thank you very much. So with that in mind, please, our first speaker is right here. Ms. Wendy Umetsu, and forgive any mispronunciations of your last names.
My son Hero was born January 2014, and we began to follow the vaccine schedule recommended by the CDC. This picture was taken after he seized for almost an hour following his 4-month shots. Although I informed the medical staff that he had recently been vaccinated, my concerns were dismissed. I had been a mother for 15 years, and this was my 3rd child, so imagine my surprise when I was told that this was normal. He continued to receive shots on schedule as recommended, 30 doses in just the first year of his life. He continued to have vaccine reactions that the medical staff never reported to VAERS. My son was being set up for a lifetime of health problems to include seizures, food allergies, ear infections, respiratory issues, and likely death if we had continued to vaccinate him. Although he had 2 normal EEGs the first year of his life, he began to have new seizure types after his 12-month shots and has not had a normal EEG since. He was diagnosed with intractable epilepsy with at least 7 different seizure types. I had no choice but to put my son on medication that was not even approved for children his age. As a result, he suffered from numerous side effects and drug addiction at the age of 1. The healthcare industry failed my child, and I was not going to allow his decline in health to continue. I researched vaccines, and I began the process of healing my son. I obtained his medical records and filed VAERS reports on my own. I had testing done which showed aluminum and mercury toxicity, both ingredients in vaccines. I read from the CDC website that due to a family history of autoimmune disorders, none of my children, 4 of them, should have received several of the vaccines they were giving. In addition, blood testing has since confirmed that my children are susceptible to vaccine injury. The vaccine schedule is being religiously followed by doctors without concern of contraindications listed by the CDC that should be discussed with patients in a clinical setting. It's not being done. Parents are not receiving informed consent at vaccine visits. And from my experience, your child receives the shots, and then afterwards, you're given a VIS statement that looks like this, when these inserts look like this. In addition, vaccine reactions are not being reported to VAERS, and there is not an accurate representation of the post-market data that's been considered when you're discussing your vaccine recommendations. My son Hero will be 6 in January. He has had thousands of seizures in his lifetime. He still wears diapers, cannot talk, and requires constant care and supervision. I wake up every day of my life checking to make sure my son's still alive and hasn't died in his sleep. That's our reality and the reality of thousands and thousands of families who have a story just like ours. I'm here speaking today to be a voice for Hero and other victims like him. Many of us now know that the vaccines we once believed would protect our children are the very reason many of our children are so sick with chronic health issues today.
Thank you for your comment. Our next speaker will be Eve Switzer.
Thank you for this opportunity to comment today. My name is Dr. Eve Switzer. Although I am from Oklahoma, I am not related to Barry Switzer. I am a parent. Both of my children are young adults and are fully vaccinated per the recommended schedule, including MenB vaccine, because vaccine benefits far exceed their risks, and this is supported by the science. I'm also a pediatrician in rural private practice, where I, not my nurse, personally give vaccines to my patients. I was in clinical practice before the widespread use of vaccines against varicella, Haemophilus, strep pneumo, and rotavirus. I admitted and cared for children in the hospital with Haemophilus meningitis, invasive strep pneumo infections, dehydration from rotavirus gastroenteritis, as well as even necrotizing fasciitis from chickenpox. I don't miss those days. Thanks to vaccination and other health advances, it's far, far less common for a pediatrician like me in the rural front lines of healthcare to have to admit children to the hospital for preventable infectious diseases. As an active member of the American Academy of Pediatrics at both the state and national levels, I also hold a leadership position at the national level. I interact with many of my pediatric colleagues. When I received notification of the opportunity to comment today, I queried the colleagues in my office, in my state AAP chapter, as well as the AAP section on administration and practice management. The number one request from pediatricians like me on the front lines was for better guidance on the meningococcal B vaccine. Quoting from one of my colleagues in the section on administration and practice management, when the science is most vague is when the most guidance is needed, not the least. And at a time where pro-vaccine pediatricians are being verbally and physically assaulted, legislators are having menstrual blood thrown at them, and parents who have lost a child to a preventable disease and advocate for vaccination are being attacked on social media. I applaud the difficult work you do and condemn the abuse you and others who want to protect their children with vaccines are subjected to. The recommendations you make are extremely important, not only for me and my medical colleagues, but also for parents who need clear, science-based schedules to protect their children. I and many others like me, including parents, pediatricians, and other healthcare providers, thank you for doing that work.
Thank you very much for your comment. Next speaker is Mr. James Neuenschwander.
That's Dr. James Neuenschwander. I'm a physician with dual board certifications in emergency and integrative medicine, and I've had the honor in the past 32 years of evaluating thousands of children. The parents of those children will, to their dying breath, say that it was a vaccine that caused their child to descend into autism. It was a vaccine that caused their child's neurologic disorder. It was a vaccine that caused their child's asthma, their child's eczema, their child's food allergy. I know there's a huge disconnect between what these parents are telling us and what you guys are teaching us. I also know as an ER physician, and by personal experience, ignore mom or dad at your own peril. But I'm not here today to debate the safety and efficacy of vaccines. I will, however, challenge each and every one of you in this room to that debate. I will challenge the CDC, the NIH, any university out there to that debate in a public forum, but I know it will never happen. The science isn't there. I'm all about the science. The biggest cause of vaccine hesitancy in this country is the lack of true vaccine science. I am here today to ask you guys in this committee to please, the community counts on you, do your job. I used to naively think that ACIP based all their recommendations on rigorous study of multiple trials that determined the safety and efficacy of each one of your recommendations. I've since learned that ACIP is simply participating in an industry-wide phenomenon I'm going to call junk science. Junk science has allowed with all due respect to my colleagues in this room, presentation of these papers, of these studies that would never pass the rigors of a peer-reviewed journal if they were on any other subject other than vaccines. I've watched Young Science allow GSK to publish a paper on their MMR vaccine in which 10% of these healthy 12-month-old babies ended up in an emergency room in 6 weeks, and 2.5% of them developed a new chronic medical condition. But that's all okay, not because they compared that vaccine to a placebo group or a delayed vaccine group, but because they compared it to the current MMR2 vaccine. That's the moral equivalent of comparing 10 shots of whiskey to 9 shots of whiskey and a shot of vodka and saying vodka doesn't cause intoxication. Junk science also allows us to take vaccines we know don't work to just double down, increase the dose, increase the frequency. I saw this committee in the last meeting look at the pneumococcal vaccine and say it doesn't work, and yet leave it on the schedule and leave it up to us to determine whether or not we give it to a patient. I'm sorry, but that's your job. Please do your job. We already know the mumps vaccine is of questionable efficacy. We know the flu vaccine at best will prevent 50% of the cases of flu in healthy adults. We know the MMR vaccine will wear off and you'll have adults who are susceptible to measles. We stand on a threshold of a public health crisis, and vaccines are part of that. But you guys can make a difference. If we don't change the course of where we're at right now, we will have nothing but chronically ill children and adults. We'll have epidemics of autoimmunity, of autism, of infertility, of asthma, of food allergies, of cancer. But you can change that.
As a courtesy to the other
Demand
speakers,
better science.
we ask that you conclude
Demand
your comment.
better adjuvants. Demand better vaccines. I thank you.
Thank you. Next speaker is Ms. Helen Woods.
Hello. I'm not here today to introduce myself to all of you in hopes that you remember me or my name or my story. I'm not here today to tell you all how I used to blindly believe in the mantra that vaccines save lives and that vaccine science was true and heroic. I did not come to recant the heartbreaking story of how I had my eyes painfully pried open to the stark reality of just how dangerous vaccines are, as those dangers manifest themselves to me by way of my own children's suffering. I did not come here to thank you all for your hard work, your time, or your consideration. I'm not here to beg you all to listen to my emotional testimony and show you pictures of my damaged children, with the hopes that just maybe one of you would hear this mother and begin to do the right thing. Many that have spoken before me in the meetings past talk about the ability you all have to stand on the right side of history with us and how each of you have been given a high calling. Each of us that come here 3 times a year are here to acknowledge the weight that each of you carry. But our cries always fall on deaf ears. We ourselves are not acknowledged, and that is why I'm here today, because I have been given a high calling. I am a mother, and so I am here speaking to you as a mother, not because I'm some truth warrior, justice seeker, or motivational speaker that was paid to be here. I am here for my children and their children, and so on. This battle for vaccine truth is just a single fight in the great war between good and evil. And as a mother, God gave charge of his 3 precious souls to me during my time on this rock. And with that calling is my obligation to speak the truth as I have found it, and always, always teach my children to stand up for what you believe in, to stand up with a loud voice against the lie, and to be brave. And so it is not for you or anyone else's amusement that I'm here today, but only to show my children in the way that they should go so that they might not err from that truth. Vaccines do not save lives. You are all not an authority on my children or how God charged me to raise them when he gave them to me. I do not and will not beg for your acknowledgement or exposure of a corrupt system for which you yourselves are already entangled in and serve diligently. I am not here to educate you all on the data of vaccine injuries because that data comes 3 times a year here to fill this room. You still don't listen. And all of you already know the truth, just as I do and just as my children learned. I am here to speak because I was given this opportunity to be brave. And as I would want my children to stand and fight for whatever truth needs defending when their time comes, here I am, standing in my own time, Vaccines do not save lives, but you all already knew that. Thank you.
Thank you for your comment. Our next speaker is Ms. Amy Gordon.
From the real front lines, parents have had it. Over 54% of our children are now diagnosed with a chronic illness. 1 in 6 has a developmental disability. This is a spike that you, the CDC, just publicly noted. And your only responses are 1, add more vaccines to the schedule, 2, promote greater and greater uptake of vaccines. If you want us to take you seriously, you need to 1, stop insulting our intelligence, 2, be completely transparent with the public about vaccine side effects, and 3, address our concerns. And believe me, parents have many. A dozen people get sick from eating romaine lettuce, and it's pulled from the shelves. When a 2-month-old baby dies within hours of getting 8 different vaccines at a well child visit, nothing is done. And parents are told that it's a complete coincidence. So your message is that saving Americans from produce is more important than investigating countless infant deaths and what's spurring our country's escalating infant mortality rate. These parents are waking up to the fact that vaccines are the leading cause of unexamined coincidence worldwide. Just last week, the media was filled with reports of baby food containing heavy metals, and there was outrage, and officials are now calling for a federal probe. Yet somehow we're supposed to believe that those same metals in vaccines are magically safe? When parents access mainstream scientific journals, they find overwhelming evidence that these same heavy metals in vaccines can cause significant neurological damage to our children. Last week, the media also reported on chickenpox popping up in a New York State school system, despite the expulsion this year of all unvaccinated or partially unvaccinated students. A letter from the school was issued stating, you can still get chickenpox when you're vaccinated, and that getting chickenpox naturally provides lifelong immunity from the virus. And that leaves parents with many more questions than answered. The CDC website says that your committee's role is to look at the safety and effectiveness of a vaccine before it's recommended. However, watching the video of your committee unanimously recommending the new Hep B vaccine, even in light of fatal cardiac events, dramatically undermines our confidence in who you serve. What the American public sees is your absolute unwillingness to have a fact-based, honest dialogue around vaccine benefits and risks that moves beyond the mantra of safe and effective.
Thank you for your comment. Your time has expired.
Yet, when everyday people like myself ask questions about safety and efficacy, we're labeled anti-vaccine and listed as one of the top 10 threats to global health. You have created an army of pissed-off parents, pissed-off grandparents, and angry citizens who value their health and value their medical freedom. You have indeed awakened the sleeping giant, and we are filled with
As a courtesy to
unyielding
other speakers,
resolve.
we ask that you conclude your comment. Next speaker is Mr. Chad Hayes. Mr. Hayes, are you in the audience? We'll move forward. Laura Moretti, please.
Hi, good morning. I have a couple of quotes for you. Albert Einstein said, "The important thing is to not stop questioning. Curiosity exists for a reason." Euripides says, "Question everything, learn something, answer nothing." I'm very grateful today to be here and have this opportunity to speak in front of you. I noticed that you all have a very important job. In your description that is listed is required for you to have the ability to evaluate complex issues and weigh conflicting opinions. You are required to have high standards of impartiality, integrity, and objectivity so that you can provide guidance for a safe vaccine. Today, I am questioning the safety of the CDC recommendations. As a former law enforcement officer and a detective, I have been concerned at the growing numbers of SIDS deaths, specifically when the numbers show that it primarily happens at the 2-month and 4-month of age. And upon interviewing these parents, they do nothing about VIRS, and it also is very concerning that they just vaccinated them, and within within 2 weeks to hours of death. It's primarily 2 weeks. So it's very concerning. I also find it very alarming that there are no studies that consist of saline placebos or double-blind placebos. There are no vaccinated and unvaccinated studies, except for the ones with the deceiving labels. Again, if you investigate them, you'll see that it was deceiving. There are no long-term health outcome studies. I find that very alarming. I'm surprised that you don't. I do appreciate that a couple of you have some questions. And I also must remind you that United States has the highest rate of infant mortality in all of the developed nations. Yet, we're the most highly vaccinated at the youngest ages. But I suppose it's just coincidence. All right, I've got a couple of quotes for you here. Well, actually, my question for you today is, again, question everything, is, are you truthfully standing by your word and oath as your job description today? Are you demanding better and safer vaccines? Because vaccine injuries are not rare, and death and injuries are real. Vaccines should never be mandated. I have 2 more quotes for you. Let's see if you can decide who they're from, okay? Let's take a guess. The state must declare the child to be the most precious treasure of the people as long as the government is perceived as working for the benefit of the children. The people will happily endure almost any curtailment of liberty and almost any deprivation. That's the first quote. The second quote is, if you tell a big enough lie and you tell it frequent enough, it will be believed. Just like the lie of vaccines are safe and effective. Guess who those were by? Hitler, Adolf Hitler. And everybody liked him.
Thank you for your comments.
Everybody liked him.
Our next speaker is L.J. Tan.
Thank you, Mr. Chair and Madam Secretary, for this opportunity to comment. Good morning, everybody. My name is L.J. Tan, and I'm the Chief Strategy Officer for the Immunization Action Coalition, or IAC. IAC works to prevent disease by working on state and national policy to improve implementation of safe and effective immunization services across the country, and by creating and distributing educational materials for health professionals and the public that support the delivery of these important immunization services. We also work to increase immunization rates and prevent disease through facilitating factual and evidence-based communication about the safety and efficacy of vaccines within the broad immunization community. As part of that work, I co-chair the National Adult and Influenza Immunization Summit, a partnership of more than 130 national and regional stakeholders committed to protecting the lives of children and adults through increasing the awareness and implementation of ACIP recommendations on the ground. The summit is a strong proponent of the immunization neighborhood, where all providers who touch a patient have responsibility in ensuring that the patient is properly immunized, be it through communication, collaboration, or coordination of services. IAC recognizes the difficult work that the ACIP does in balancing the multiple factors of cost effectiveness, process implementation, and evolving science, while ensuring that the country's vaccination programs are safe and effective as they are now. We commend and thank the members of the ACIP for their dedication and service. This was so well evidenced in your discussion and in your vote on the 2 immunization schedules that will occur tomorrow. IAC urges the ACIP to also consider the wealth of knowledge and experience within the stakeholders that are represented in the state immunization coalitions and within the National Adult and Influenza Immunization Summit. They remain ready and willing partners to serve as focus groups and to provide feedback on implementation of recommendations from the ACIP as they roll out across the country. They're also strong partners on the ground to increase understanding and awareness of ACIP recommendations to providers across the country. Indeed, to facilitate implementation of immunizations, IAC has just designed an elegant new Vaccines Save Lives pin on hard black enamel with gold lettering and edges. And just in time for the flu season, IAC is also pleased to announce its new flu vaccine buttons and stickers. These are modeled after I voted stickers, which are given to voters in many states as they leave the polls. These flu vaccine buttons and stickers are bright red to help you broadcast this important vaccination message. Wear these pins on clothing, uniforms, lab coats, tote bags, backpacks to show that you value the vaccinations. We also have stickers that you can give to your patients. If you have any questions, please reach out to any of the 5 IAC persons here, myself, our Executive Director, Dr. Deborah Wexler, Dr. Sharon Hummiston, Laurel Wood, and Julie Murphy. We have been passing out free samples and on the table outside, there are flyers on how to get them online. Thank you for this wonderful opportunity to provide comment and for the service you provide.
Thank you for your comments. Our next speaker is Ms. Donna Dreyer, please.
Good morning. My name is Donna Dreyer, and I'm a registered nurse in California and in North Carolina with a Bachelor of Science in Nursing degree. And I'm also a mumps and chickenpox survivor. No offense, but I'm guessing by looking at each of you on the panel before me, many of you could say the same thing, that you not only survived, but have thrived through many of these same childhood illnesses. I came into this profession with the anticipation I would help people to recover and heal from their medical issues. Sadly, the longer that I'm in this career, the more I have experienced disillusion with a system that is very broken. A system that can hardly be called healthcare, but instead has become sick care, doing damage control. We no longer treat people as individuals. We are a system that focuses on masking symptoms by prescribing a cocktail of pills for them to be on for the rest of their lives. Medicine and healthcare should not be considered a one-size-fits-all practice. No drug is 100% safe 100% of the time for 100% of the people. We are one of the most heavily vaccinated nations in the world, and the facts of health outcomes in the United States speak for themselves. One only needs to look at our ranking with other developed nations to see how sadly we are failing. It is a known, embarrassing fact that among developed countries, the U.S. has a much higher mortality rate at birth. What we should be asking is why? Why? Because vaccines never have and never will equate to optimal health. True health is not gained by injecting immune-suppressing toxins like heavy metals, carcinogens, allergens, inflammatory chemicals, animal and insect cells, and male and female human DNA components. True health does not come in a syringe or a pill. There's a time and a place for government oversight of the healthcare practices in our country. Good medicine begins with doctors who are being exposed to the whole truth and who are free to practice without unfounded constraints from the government. Corporations have no place in running our government and or our healthcare system. Please prove us wrong and restore the public's confidence once again in the pharmaceutical products you support as vital to good health. Ensure those double-blind inert placebo studies are conducted and the results addressed appropriately. Let's look at immunity post-vaccination. Compare vaxxed versus unvaxxed health outcomes. Submit statistical analysis of test data to be reviewed by independent audit. return liability to the vaccine makers like every
Thank you
other
for your
drug
comment.
manufacturer
Your time has
has.
expired.
Help rebuild the confidence and respect of the people. Show that you truly do promote safe and effective products. Have no doubt that your attempts to silence and censor us will not succeed. They're only making us stronger.
Thank you for your comment. Next speaker is Jennifer Coe.
Hi, my name is Jennifer. I want to start off by saying I appreciate all of you that are here today on both sides of the rope. I know it's a difficult thing to take time out of our busy schedules to be here. It's a sacrifice for most of us. I also want you to know that I respect your positions on this panel. I truly feel that most of you are here because you want to help people. This is not my first ACIP meeting. I came here in February with a truly open mind, and I left here concrete and more steadfast than ever in my decision to stop vaccinating my son. You see, I come from a slightly different background than many other ex-vaxxers. My son was vaccinated according to your schedule up until 15 months of age. With the exception of the MMR, he will never get that vaccine. Dallas is not vaccine injured. Following some common reactions, an acquaintance of mine came alongside of me and gently encouraged me to delve in deeper to vaccines. Their ingredients, their side effects, what's listed on the insert, not the fact sheet that you're given, and into genetic mutations, of which my son had several markers. She didn't tell me what to believe. She didn't tell me that vaccines are poison. And I'd be lying if I told you that I stopped vaccinating at that point. I didn't. I'm not the type to do anything because anybody tells me to or not to do it. I continued with your schedule, but I requested our doctor order some tests on my son that determined he did in fact have some genetic mutations. It was at that moment that I knew we were done. I was no longer going to play Russian roulette with my son's life and his health. My son can't detox as efficiently as some people and is thus predisposed to vaccine injury by the ingredients in your vaccines. I immediately reached out and sought the knowledge of parents who have gone before me. I learned how to help my son detox from the 15 months worth of toxins that were injected into him with my permission, but without any true informed consent. Dallas will be 5 in December. He's been a sitter with school-aged children since he was 4 months old. He's currently in preschool. He's healthier than any of the other daycare kids, all of his cousins, any of my friends' kids who are close in age, and fully vaccinated. In 4 years, he's only been on an antibiotic one time, and that was for strep throat last winter. I owe my son's health to the parents and grandparents sitting around me here today, and to the thousands of other parents who actively encourage people to do their own research and come to their own conclusions before it's too late for their loved ones. These are the ones who were your post-market data. These are the ones who are fighting for their loved ones, my loved ones, your loved ones. I trust what they have seen, what they've witnessed with their own eyes, over the blind trust that I have seen you folks have here in the pharmaceutical industry, hands down. I came here and I listened, I followed the process, and I was appalled. You have lost my trust and my confidence, not because anybody on social media or Google told me not to trust you, not because you have lost sight of your initial oath to do no harm. Parents and grandparents are screaming from the rooftops about their children and family members who have been harmed by vaccines and the insane current schedule, yet their cries seem to fall on your deaf ears. I pray that each of you will find the courage and strength to stand up and ask the tough questions.
Thank you for your comment. Your time has
Challenge
expired.
the data presented to you by the pharmaceutical reps. They sound like used car salesmen. And repair your severely damaged reputation. Our future generations depend on you. Be strong and do the job.
Thank you. Next speaker is Mr. Elijah Bunch.
Thank you for the time, for allowing me to be up here today. It's been barely a year since my son, Christopher, passed away. It still hurts today, just as much as it did a year ago. My heart is still as broken as it was the day I had to leave the hospital without my son. I'm not the same I was. My life has forever been changed. Merck made that happen. Our government made that happen. And you, the CDC, made that happen. Your vote killed my son. The HPV vaccine killed the most precious gift in the world. My son, my best friend. I had the joy of watching him grow for 14 years. I got to love him for 14 years. I got to be his father for 14 years. I will never stop fighting for my son. Sorry. I will never stop fighting for my son, and I will never stop telling his story. Unless you have lost a son and had to watch him lay in a hospital bed for 6 days and die, you have no clue what pain is. The day my son died is the day half my heart died. The HPV vaccine destroyed our lives. I will never forget the last look my son gave me, the last time I felt his warm hands, the last time I felt his heartbeat. That is pain. While I stand here today, I do it with a broken heart that I will forever have to live with. My family time is now spent with my son by visiting at the cemetery. Do you know what it feels like to have to walk into a room with people that you have known for years and have them stop talking because you walked in? Do you know what it feels like to be the parent of a healthy child because you chose to follow and trust the schedule that you guys made, and then he suddenly dies? Do you know what it feels like to be that same parent trying to understand why and how you don't see what is happening to our children? Well, I do. I hope that the next time you vote on the HPV vaccine, you remember my son. You remember the story that I'm telling you about my son here today. Think of how you would feel if this happened to your brother, your sister, or your child. I'm sorry. I wanted to speak with you guys today because I have a voice and I have to be my son's voice. So I hope that you guys take this into your hearts and into your minds and remember what we said here today. Thank you very much.
I'm sorry for your loss. Thank you very much for your comments. Our next speaker is Julie Murphy, please. Our next speaker is Julie Murphy.
Hi, this is Julie Murphy. I work at the Immunization Action Coalition in St. Paul, and I'm very sorry for your loss, Mr. Bunch. It's difficult to speak after hearing that. But I'm here because I want to thank you in this room, the members of ACIP, the liaisons, and all of the people who participate in the working groups. Thank you for the work that you do, not only in this room, but year-round. I truly appreciate it. I am the mother of a fully vaccinated young woman, and this group is part of the safety net of scientists, doctors, nurses, pharmacists, and more. As a single parent, I was grateful to have a group like you, a group of experts, who could ensure that the childhood recs at that time, and now the adult recs for her, are safe and effective. If I had not chosen to vaccinate Allie, I can't help but think what it might feel like if in 5 years she were diagnosed with a cancer that had a vaccine that could prevent it. If she looked at me with eyes and said, wait a second, there was something that you could have done to prevent this, and you didn't, I don't know if I could live with myself. But because of those of you in this room, I did choose to vaccinate her. And I vaccinate, I'm nervous. I vaccinate for more than myself and my daughter. I do it for others in the community. I have a nephew who has cystic fibrosis, and I see his daily struggles, the struggles of his family, the multiple surgeries, the dozens of pills, the nightly feeding tube. He can't fight illness by himself. He needs and relies on a community who is fully vaccinated so that he can remain healthy and live the fullest life that he can live. I choose to vaccinate because vaccines do save lives. To all of you on this side of the rock star, I choose to call this the rock star boundary. You are rock stars, and you're my heroes, and thank you so much for the time and effort that you put into this day in and day out, not just 3 or 4 times a year. Thank you.
Thank you for your comment. Our final speaker will be Caitlyn Cole, please. Clobus.
Thank you for giving me the opportunity to speak today. For those who are on their computer while a man talks about his dead son, you should be ashamed of yourselves. I'm here to talk about sudden infant death syndrome, now commonly known as undetermined, unknown natural causes, hell, even positional asphyxiation. SIDS, and its well-developed relationship to vaccines. Now, I've read study after study about SIDS and vaccine, and what has stood out to me the most is the common denominator in all these studies is that most of them end at the hypothesis, and the investigation that the conclusion of the study demands is never completed. Why? You have known about this for decades, known that some vaccine components can trigger a lethal outcome in babies, that some vaccine components can produce a range of cytokines that cross the blood-brain barrier and suppress on an underdeveloped medulla, inducing a SIDS episode in a vulnerable adult or infant or child. In the past 8 months, I've spoken with several of the best neuropathologists in the world, one who doesn't even specialize in SIDS. He specializes in chronic traumatic encephalopathy in football players, and even he knew that some hypersensitivity to certain proteins in vaccines can cause a fatal outcome in an infant, and explained to me the simple testing that needed to be done after separating the serum from the blood post-mortem and running cytokine tests on that serum. Any medical examiner can run these tests, yet they don't. You know about this. They know about this. Why don't we know about this? We, being the parents of these infants. Because on February 27, 2019, if my doctor had told me now some infants have vulnerabilities to the point that death can occur shortly after vaccines, I would have grabbed my daughter and got the hell out of there. And then the morning of March 1st, a mere 36 hours later, I wouldn't have found her cold, pale, lifeless body. Then I wouldn't be dealing with a corrupt medical examiner who refused to do any additional testing on my daughter, saying it wasn't medically necessary. Never even examined her brain, and when I hired second opinions who found things, she falsified documents and changed my daughter's cause of death to positional asphyxiation based on no evidence, and despite expert opinions, stating it was because of my desire to petition vaccine court. She's a lunatic. Many parents have reached out to me with similar stories of inadequate autopsies and discriminations. If medical examiners and doctors are not investigating, how is the committee supposed to know if their recommendations are even safe? Because my daughter was not collateral damage for the greater good. Her name was Evie Gale. She was 6.5 months old. She was beautiful. She looked just like a little doll from the day she was born. She had these piercing eyes that glowed, this gorgeous smile and a laugh that could end a war. She was well-developed, well-nourished, and flawless in health. She was my best friend, one of 3 loves of my life, and my heart feels it's not even there most days since my love story with her ended.
Thank you for your comment.
Her
Your time
name
has
was
expired.
Evie Gale Clobus, and she did not die from co-sleeping with her mother 36 hours after she received 6 vaccines. Your recommended schedule killed my daughter.
Thank you for your comment. That concludes our public speakers' comment section. We will. We'll adjourn at 1:45 this afternoon. Thank you all.